I'm Dr. Beatrice Bonyo, a gynecologist for the past 20 years. I've been practicing initially at the government hospital up to the year 2000, from 1992 to 2000 and 2000, when I opened this institution, Milimani Maternity Hospital, and I've been running this institution as the resident obstetrician gynecologist up to date. On top of pap smear, we also do VIA and VLI. We do to check for the changes in the cervix, as we use some chemical and apply it on the cervix. Then we see areas which show changes, and that will give us a suspicion that somebody is likely to develop cancer. And where it is possible, we can do biopsy. Those who are not likely, the women who are not likely to develop cervical cancer, are women who are not sexually active. That's why it is found that the women who are nuns usually don't have cancer of the cervix. It can be genetic, but because you find that when people develop cancer, they have history of cancer in the family. Some do have history of cancer in their family, like a mother having had it, or an auntie, or a sister. HPV infection. Those who get human papillomavirus infection, eventually some turn to get cancer. So, and human papillomavirus is usually gotten by those who are sexually active. The treatment for cancer of the cervix can be given, by using the chemotherapy drugs. And then we can also use radiotherapy. And also we can use, if it is in early stages, we can do corn biopsy. We could also just do a generous biopsy around that lesion, so that if it is small, we can just get rid of it. So there is biopsy. We can excision biopsy. We can also do the corn biopsy. We can also give chemotherapy, and then we can also give radiotherapy. Those who have cervical cancer, they are at risk of developing complications of blockage of the ureters, because when cancer involves the both the ureters, then you find that the kidneys cannot, they cannot get release the urine, so they end up with hydronephrosis or even failure of the kidneys because of that. They also bleed a lot, and they might die from that cancer of the cervix, from bleeding severely. In fact, most of them die from severe bleeding, because when it has affected the cervix and even the tissues around, now it is an open wound which keeps on bleeding, discharging infection and bleeding, and then they are always being transfused, in fact, until eventually you just lose them like that. So you could also get it can affect the rectum when the cancer spreads to the rectum, or the cancer spreads also to the bladder. So there are complications. And when it is now widespread, it can go to the lungs, depending on the type. I thank the audience who have listened to this interview or presentation. And if you wish to see me as your gynecologist, you can book me through ponea.com and book for your appointments if you would like to be seen by a gynecologist. Thank you very much.